My name's Crystal LaFerrier and I'm from Calgary. I have Crohn's disease and I've had it for about 3 years now. I was diagnosed in 2010. My GI doctor had referred me on to Dr. Seow to come talk to her kind of getting pregnant or thinking about having a family, just to kind of talk about just what to expect, what to do for medications, vitamins, all that kind of thing. So basically just to kind of help alleviate some of those fears of the unknown with having Crohn's disease in pregnancy. I think just a little bit of the fear of the unknown, how the medications will affect the baby, or that fear of possibly having a flare-up in the pregnancy, especially in that 3rd trimester where there's the stretch of time of not being on any medications. Just wondering how that will affect my health and the baby's health. So.
I'm Dr. Cynthia Seow. I'm one of the gastroenterologists here at the University of Calgary. I run a specialised inflammatory bowel disease and pregnancy clinic with my colleague Dr. Yvette Leung. Inflammatory bowel disease is a chronic condition which is characterised by inflammation of the gastrointestinal tract. So patients can go through good times where they are in remission, meaning that they have absolutely no symptoms and are no different from you or me, and other times unfortunately have relapses where they may have symptoms that range from abdominal pain, bleeding or diarrhoea. If a woman has a flare-up during her pregnancy of her inflammatory bowel disease, the individual would come to our specialised clinic and would be assessed clinically, meaning that we would ask her what her symptoms were. We would take the same routine blood test that we would do even if she wasn't pregnant, but we may tailor some of the investigations accordingly. For example, we would not expose a woman who was pregnant to having x-rays or a CT scan, but they would have more non-invasive investigations that don't involve radiation, such as an ultrasound. We also wouldn't be keen to do a colonoscopy or any endoscopic procedures that may be more concerning during pregnancy. The main message of our clinic is to make sure that the mother enters the pregnancy well, that she is healthy before embarking on the pregnancy, and therefore that gives her the best chance of remaining well during the pregnancy. It's only in the very extreme cases, usually when the mother is actually not aware that she had inflammatory bowel disease during the pregnancy, that she comes in with an acute abdomen that may require surgery, and that obviously can be very concerning for both mother and for the health of the baby.
So I'm Dr. Yvette Leung, and I'm a clinical assistant professor here at the University of Calgary, and myself and Dr. Cynthia Seow, we run the Pregnancy and IBD Clinic. The maternal care for women with inflammatory bowel disease essentially is the same as maternal care for someone without inflammatory bowel disease, except in this case, in our clinic, we obviously focus a lot on the management of their IBD, because what we want is to keep their IBD quiet during their pregnancy, such that they will have the best chances of having a healthy pregnancy and delivering a healthy baby. In terms of the possibility of pregnancy bringing on a flare, that is possible because of the changes in the immune system that happen naturally during pregnancy. And that's what is so exciting about this clinic and the research that we're doing. In fact, we're trying to look at what factors and what changes in the immune system can actually predict whether or not a woman will have very quiet disease during her pregnancy, or in small numbers of cases actually flare during their pregnancy. The research question that we're trying to explore is essentially we want to look at the outcomes of pregnant women with inflammatory bowel disease in terms of what happens during their pregnancy, as well as the health of their baby. We're very excited about this research because although globally there's data on this already, what makes this a unique study is, first of all, this will be the only Canadian study to date that looks at this, and also because of our ability to biobank, we can actually look at changes potentially in the immune system during pregnancy, and also very importantly look at changes in how a pregnant woman's body might metabolize drugs differently than when she was not pregnant. So that is a very unique part of this registry and something we're all very excited about. Our main hope for this clinic and our study, and something that both Dr. Seow and I feel so strongly about, is that pregnancy is such an amazing time for women and her families. And we just really want the women who go through this clinic to know that as long as their disease is quiet, that really they should be just as happy and just as excited as any other woman out there without chronic disease. And to just really enjoy the 9 months and enjoy her baby. And myself and Dr. Seow and the nurse clinicians that work with us, we're their team, we're their support, and we love seeing those babies when they bring them in afterwards.
I think this clinic's really good just for having like that extra support network of doctors and just having that information at your fingertips that you can't really get anywhere else. So I hope it helps other women and the hope for me is just to have a healthy pregnancy and a healthy baby.